Hello, good morning, and welcome to Israel Healthcare Highlights, where we share important information about Israeli healthcare with English-speaking audiences around the world. Our special guest today is Professor Shlomo Winker. Hi, Shlomo.
Hi to you, Bruce, and to the audience.
Good. So our topic today is primary care in Israel. And before we do that, Shlomo, please tell everybody a bit about yourself.
Okay, so first of all, it's a pleasure to me to be here in your Ulpan for an interview. My name is Shlomo. I am a family doctor, a board-certified family doctor. I ended my residency a few years ago. And since then, I am doing both managerial and practical work. I work as a family physician, a clinician part-time. And most of the time, I'm the medical manager, medical director of Leumit Health Services, one of the Kupot Cholim HMOs in Israel. I am doing also a lot of other work, like academic work. I have more than around 300 PubMed publications. And I'm also active. I used to be the chair of the Israeli Association of Family Doctors, and now I am the chair of the European Association of Family Doctors. And I also a full professor at the Tel Aviv University at Faculty of Medicine.
Excellent. Thank you. So please get us started. Tell us a bit about family medicine or primary care in Israel.
Okay, so family medicine, primary care in Israel are quite synonyms because in contrary to other countries, the main care providers in primary care in Israel are family doctors. They work in conjunction with nurses, but the main activity is by family doctors. We don't have yet physician assistants, or we only started nurse practitioners. So at the end, primary care and family medicine in Israel are synonyms. We are giving the service. All the citizens of Israel are covered by the national health law. So we are giving equal service to all the population. And this is given by three healthcare organizations. We call them Kupot Cholim. This is an historical term. Most of them were founded even before the state of Israel. Some of them are older than 100 years, and the state of Israel is only 77 years. So it is something historical that has been regulated by the new insurance law around 30 years ago. So we are giving service all the Kupot in a nationwide distribution, which means there is in every area and every city, every town, every village, competition between the healthcare organizations, which means that you have to invite yourself all the time. You have to be better and more attractive to the patients, to the population all the time, because otherwise they will leave you to another healthcare organization.
Okay, so let's focus in though on primary care and the role of family medicine and some of the challenges it faces and how it's changed over recent years.
Okay, so the service is given mainly by qualified board-certified family doctors, either in family medicine or internal medicine. And the rest, which the percentage is going down during the years, are by what we call generalists, which means doctors that didn't went to a residency program and are serving. But in recent years, the number of residents in family medicine is increasing substantially. So we can forecast that in 10 or 15 years, the majority will be served by board-certified family doctors.
So that's very interesting. Why is the number of residents enrolled in family medicine gone up in recent years?
The profession became very popular. I can tell you that in Leumit, I am the chief medical director of Leumit. We doubled the number of residents, and now it's around 15 per year. And for these positions, we had last year more than 300 applications.
Oh,
Okay,
wow.
so it's very popular, and I know that the situation is similar in all the Kupot Cholim. There are several reasons for this. First of all, when you become a specialist, it's easier in the kupot to work part-time. The young generation want to work part-time, not full-time. So if you are in the hospital, it's much more difficult to not to work full-time. Our salaries are relatively good in comparison to other professions. And
other medical professions, other medical
yeah,
staff.
medical profession.
Oh, that's great. I know that's not
And
true in a lot of.
also,
I know
and
that's not
also,
true in a lot of countries. In a lot of
yeah, I
countries,
know that it's not the same in other countries, especially not in the East European countries, where to be in the hospital is much more profitable. And of course, I'm not so objective, but I think it's a wonderful profession, so very interesting. So this is another reason why it is so attractive.
yeah, of course, it's been a wonderful profession 30 years ago as well. So how does that relate to what's changed? Why has it become more popular? Has it become a better profession? Has the academic aspect of it enhanced? What are some of the things that have changed? So
I think that, as I said, it's more attractive to work part-time. Many of the young doctors are working part-time nowadays. I saw it. We see it even with our graduates, where they have to give back after the residency. Sometimes they say, okay, we will do it half time and double the number of years, because people want, this is the years of productivity. And you know, in Israel, children are very important. In contrary to other countries in Europe, we have high reproductive rate, even among academicians and family doctors. So it is not it's not rare to see families with 3-4 children, and the young doctors really want to allocate time to grow up their children, what we didn't do in the past. And also,
I'm sorry, you first.
and also in Israel, the status of family medicine is quite high. I know from my experience from many other countries, we have a lot of privileges, for example, of prescribing medications, prescribing laboratory tests, referrals, imaging tests that we can send that are limited in other countries. Which gives you the option to treat more complicated patients by yourself and not by referral. I know that in some systems, you refer a patient and then you lost it. The patient is continuing all the follow-up with the specialist and not with the family doctor. So the healthcare system is supporting you as family doctor. So I think it's another way of attractiveness.
Now, you mentioned children. What about the care of children? Is that done mostly by pediatricians or by family physicians?
Okay, so yes, I talked about the children of the doctors, but now let's talk on the children as patients. So again, it's unique to the healthcare system in Israel that we have what we call primary care pediatricians. There are countries where the pediatrician is only a consultant like other specialties, and you can see him only in the hospital. In Israel, we have primary care pediatricians. Most of the children are treated by pediatricians. Only around 20% of patients under the age of 18 are treated by family doctors, and most of them are, you know, the youth and not the children.
How has the war affected the work of the family physicians?
Okay, so first of all, at the beginning of the war, there were areas where patients and the community just left. So we had a very big challenge to continue to give treatment to those that left their homes and were stayed for a long time in facilities like hotels and hostels, etc. So we organized ourselves, all the HMOs, to open clinics in those hotels. For example, the Dead Sea hosted thousands, the Dead Sea resorts hosted thousands of
Evacuees.
Evacuees, yes. And of course, there are no facilities, no pharmacies, no clinics. So we, for example, in Leumit, we opened a clinic in one of the hotels with a pharmacy, with nurses. We also send there specialists, consultants to help the family doctors. And we did rounds of every week, another family doctor came. So this was the first issue. Second is those that were not evacuated. Of course, we had to cope more with psychological, psychiatric stress, and the Kupot and also the national insurance opened special tracts to increase the availability of psychological support, but at the end it also came to the family doctors and the pediatricians.
Okay. So what do you see looking ahead? What do you see as the most important challenge facing family medicine as a profession in Israel?
Okay, so we have a lot of workload. I just checked the figures this morning for another meeting that I have to be, and we found that nowadays around 40% of the encounters are not face-to-face, or by telephone, or by video, or by correspondence. It started and increased in the era of COVID, where people didn't come to the family doctor or to doctors in general, but it stayed high even after COVID, and in parallel, the number of face-to-face visits increased. So there is an increased workload on family doctors. The population is getting older and with multimorbidity and a lot of medications, what we call polypharmacy. So when you have workload, you don't have enough time for each patient for those. So the challenge is to see how we can reduce the norms. How many patients do you have to see per day? And the obstacle is that you are paid according to the number of patients you see. So you can decide if there will be enough doctors to see less patients, but then your salary will go down. So we have to find a balance between how to reduce the workload without significantly damaging the income. This is one challenge. The second challenge is the distribution of doctors. It's a general problem in Israel, but it is more exaggerated in primary care, in family medicine. We have a lot of applications in the center of Israel, but if you are going to the area of Jerusalem or to the south, it's very challenging to find doctors. And if it's a consultation, you can say, okay, from time to time, the patient can drive outside the city, but primary care family medicine should be given in your own neighborhood, which means, so we have enough doctors, but the geographic distribution is not good.
Shlomo, this has been excellent. Thank you so much for the interview, but thank you even more for the work you do day to day, both as a practicing physician, as a physician leader in your health plan, and as a leader of family medicine in Israel and internationally. Thank you.
Thank you, Bruce, for the opportunity to talk with you and the audience. And of course, if there will be questions, you can give my email and I can answer questions of the audience.
Thank you.